Hey guys, hope you all are doing good. And today we will discuss about childhood mental disorder. That means continuation of the last video. In the last video, we had a discussion regarding childhood mental disorders, a brief description. Okay, so today we will discuss about one of the childhood mental disorder, that is anxiety disorder. So, what is anxiety disorder? It is characterized by fear, distress, and worry. The child is showing fear towards anything or any subject, or distress or disability, or worrying about something. In that case, definitely we need to think about that child. So, anxiety disorder is characterized by fear, distress, and worry. Some level of anxiety is common for every child while growing up. That is a part of development, like fear of being alone, closed space, darkness, stage fear, open space fears, crowd, etc. In usual cases, it won't last for a quite long time because all these things, as I've said, part of development. But the thing is persist and disturbing the child in their daily day-to-day activities means at that point we need to think and we can call it as anxiety disorder. This anxiety or anxiety disorder affects the behavioral pattern of the child as well as the thought pattern and every day-to-day activities. What are all the signs and symptoms of anxiety disorder? They are irritability, restlessness, nervousness, panic attack, breathing difficulty or shortness of breath, sweaty hand, headache and stomach pain, feeling helplessness, hopelessness, powerlessness, overwhelming, sleeping problems, school missing, no friends, no social gathering, and some psychiatric symptoms also we can see like flight of ideas. Their ideas will fly from one point to another point within a second. Then they will show obsession and compulsion in their activities, perfectionism in their activities, and they will always show impaired cognitive ability because they don't get time to think. Though they get time to think, they are in the anxious mode and poor judgment. So these are all the common symptoms or signs of anxiety disorder. While coming to the risk factors or the reasons behind this anxiety disorder include stressful events. Stressful events might be anything, any kind of thing, any kind of stress the child undergone. Sudden shift of familiar house to school. The child is habituated with the school and house and too much attachment towards the particular place, and suddenly you are shifting or relocating the child from the particular area or particular school or house can create anxiety disorder. Then parents fighting, family arguing or family problem, divorce, death of very close person, serious illness, accidents, bullying in the schools or college, and being abused or neglected. So these are all the risk factors which can create anxiety disorder in children. While coming to the types, we can see few types. They are generalized anxiety disorder, panic disorder, phobic disorder, specific phobia. That is a subdivision of phobic disorder. Then separation anxiety disorder and social anxiety disorder. So these are all the most common type of anxiety disorders in children. So the first thing is generalized anxiety disorder. That's the first type of anxiety disorder in children. It is characterized by preoccupation with worries or constant preoccupation with worries. Children with GAD or generalized anxiety disorder may worry a lot about everyday things which is happening around them. They want to be everything perfect and afraid of criticism. They will ask reassurance from others every time for all the things what they are doing. Like, shall I do that? Can I do that? Is it okay? Whether we can go ahead? Always. They easily frustrated people. They always miss schools and friendship. And they will try to isolate themselves and avoid all type of social activities or public activities. So these are all the characteristic features of generalized anxiety disorder. Now we will see the next step of anxiety disorder, that is panic disorder. Panic disorder is characterized by continuous anxiety attack, continuously fear, distress and irritability. Panic attacks comes on very suddenly and for no apparent reason. So that is a specialty of panic disorder. Next thing is phobic disorder. Phobic disorder is characterized by unrealistic and overwhelming fear of a object or situation. Unrealistic, that is not real, overwhelming. too much happiness, too much sadness, everything together. And fear of object or situation. That is known as phobic disorder. And another type of anxiety disorder is specific phobia, that is a subdivision of phobic disorder. It is characterized by unrealistic and irrational fear of a specific object, fear of water, fear of height, fear of darkness, fear of lizard, fear of marriage. So specific thing, specific situation. That is known as specific phobia. So what is the reason behind this phobia means? Nothing. Anxiety. So these are all the another type of anxiety. So the next type of anxiety disorder is separation anxiety disorder, and it is characterized by excessive anxiety when they are away from their parents, from their home. It's because of worry about bad things happening to their parents or caregivers while they are away from the school or away from their home. So they will try to refuse to go to school, camps, sleepovers, etc. So the anxiety create a difficult situation in their behavior aspect as well as in their daily activities. So that is known as separation anxiety disorder. Next type is social anxiety disorder. The word itself meaning is there. It is otherwise known as social phobia. Anxiety due to social activities or when you are in a society, when you are talking to someone, when you are facing someone, when you are doing something in front of others, you are feeling some anxiety or the child is feeling anxiety or fear means that is known as social anxiety disorder. They have fear of doing something in front of others and have an overwhelmingly strong fear of being judged or getting embraced. This is known as social anxiety disorder. Now we will see the treatments for anxiety disorders in children. They are counseling, cognitive behavioral therapy or CBT or talk therapy, and anxiolytic drugs. Counseling is the process or the procedure which helps the child to understand what is the reason behind their anxiety, and also it will help them to overcome the situation. And the treatment modalities are CBT and anxiolytic drugs. So what is CBT or cognitive behavioral therapy for children? This therapy will help the children to understand their maladaptive behavior or their negative behavior, and also will help them to learn how to replace this negative thought and behavior into positive one. Parent, therapist, child together need to discuss to get better results. It includes some 6 sessions to 20 or more, depending on the child and the particular goals. And the treatment plan can be modified to meet the cultural or regional differences. So if we wait, definitely we will get better results from CBT. Now we will see some techniques used in CBT. They are play therapy. Play therapy include any arts, crafts, plays, dolls, puppets to address the problems as well as making them to engage in some activity. So the basic concept behind this play therapy means nothing. Make the child to engage in some activities to deviate their mind, to change the negative thoughts into positive thoughts. Second thing is trauma focus CBT, trauma focus. So here the CBT therapist will focus on the specific trauma or injury which the child undergone, and that will help the child to specifically focus on the problem. So what is the reason behind their anxiety? What is the situation? What is making them to be anxious and what thing can making them to be happy? So that is trauma focused CBT. Next type of CBT technique is restructuring. So it is mainly using to restructure the negative thought. Some children having a negative thought regarding their academic performance, especially in some particular subjects. For example, I'm not good in maths. Like that some children will complain, and that is the reason will be there behind their anxiety. So in that case, the therapist will start to work on their confidence, to boost their confidence, to change the maladaptive behavior into adaptive behavior. At last, the child will tell, I'm not a loser because I'm good at other subject. I'm not good in maths, but I'm good in other subjects. That's enough. Okay, I can perform. So that is known as restructuring. So here what we are doing means we are trying to restructure the negative thought with positive things. Then exposure. That is another technique which we are using in CBT. Exposure means the therapist slowly expose the child to the things or situation that trigger or develop anxiety. If they have fear of closed space means the therapist will expose the child to the closed space slowly, gradually. So first time or second time, the therapist will stay with the child, the family will stay with the child. Second time, third time, fourth time, automatically the child will get a realization that there is nothing to worry. So slowly exposing the child to the things or situation that trigger or developing anxiety, that is known as exposure. It is another technique which we are using in CBT for children. Next is modeling. The therapist may act as a model of the desired behavior, such as how to respond to a bullying, and ask the child to demonstrate. So the therapist will act like a model to show if you're suffering with this problem, you have to be like this. Then next moment or next situation in next point, the therapist will make the child to demonstrate the particular thing. That can create confidence in the child. So these are all the techniques we are using in CBT. Next thing is type of sessions which we are using in CBT. Different sessions we will use or we will use to change the maladaptive behavior of child into adaptive behavior. It includes individual. In individual session, child and the therapist will be there. Child will talk to the therapist. Therapist will talk to the child. That is individual session or individual type of CBT. Second type is parent-child. So in that session, parent, child and therapist will sit together and discuss about the problem. So in all the session, parent, child and therapist will work together. Third thing is family based. Their parent, sibling and other who are close to the child will work along with the therapist. And last one is group. Include the child and therapist and another children who are dealing with the same problem. So these are all the sessions or the types of sessions we can see in CBT for children. And another thing is lot of worksheets and homeworks are there in CBT for the children to do. So all these things will help the child to deviate their mind or to change the maladaptive behavior or negative behavior into positive behavior as well as to gain some confidence. Next, while coming to the medications or medical management, SSRIs or selective serotonin reuptake inhibitors are the commonly used medication for children. They are non-addictive and have relatively few side effects. Of course, side effects are there, but comparing to other medications, relatively less side effects. For example, Paxil, Lexapro, Fluoxetine, Lavox, Celexa, etc. So these are all some few examples commonly used SSRIs for children. So these are all the treatment modalities which we are using for anxiety disorder. So anxiety disorder is characterized by continuous fear, distress and worry. And there are different types of anxiety disorders are there. Anxiety can be treated by counseling, medication and CBT or cognitive behavioral therapy. Hope you understand guys. Thank you.